we had this oral presentation on germline varieties in patients who have neuroendocrine tumors and who had a diagnosis of this disease when they were younger than 40 years old. So this was a prospective study where we consequently enrolled patients who had neuroendocrine tumors of the lung or the gastrointestinal tract, including pancreas, without any known cancer-associated syndrome. So the rationale of this study is that we know that cancer predisposing genes have been described in many solid tumors. They have been described, some of them in NET, which leads to some rare syndromes, including the multiple type 1 and 2 neuroendocrine neoplasia and von Hippel-Lindau. But very little data is known about all the cancer predisposing genes as mechanisms of carcinogenesis in the early onset of NET. So we enrolled these patients who were younger than 40 years old when they had a diagnosis of NET, and we collected saliva and tested them with a panel of 113 cancer predisposing genes to see if we could find a likely pathogenic or apathogenic germline variety. And the definition for a germline variety to be pathogenic or like pathogenic was based on the American College of Genetics criteria. And the analysis was done through a next generation sequencing of these genes. And what we found is that among 66 patients, which were enrolled in about 14 months, 21% of them actually presented a germline pathogenic or likely pathogenic variety. And all of these patients who presented germline varieties, they had genes involved in DNA repair mechanisms. So likely this was the carcinogenesis of these tumors were associated with defects in DNA repair systems. And when we compare patients who had, the group of patients who had germline variety to those who did not, which we can call this sporadic group, we can see that the median age of onset was pretty similar, 35 years old. There was pretty much similarity in terms of gender, ECOG, stage of presentation, but those patients with germline variety had more frequently had a family history of any cancer. So this was present in 70% of them and nearly half in those patients with sporadic tumors. And also all patients who had a germline variety, they had well-differentiated NETs. We didn't find a single case of a NEC, although we had patients with NEC in the sporadic group. So what we can conclude from this study is that germline varieties apparently are common in patients who are young and have neuroendocrine tumors. Although we cannot prove causality, now we're going to do further research in order to evaluate the loss of heterozygosity in the tumor tissues in order to see if there is a homozygosis of the mutation in the wild, also in the wild allele.